Thank you, distinguished facilitator. I didn't think I would take part to this meeting like this, and I'm jealous for those who are in Dakar. Distinguished representative of the Minister in charge of Finance and Budget in Senegal, distinguished representative of the Minister in charge of Health in Senegal, distinguished representative of the West African Health Organization, distinguished Executive Director of CRES, Professor Chang, distinguished participants, ladies and gentlemen, all protocol observed. Allow me to express on behalf of ACBF in Africa, our thanks to CRES for the opportunity that they gave to ACBF to take part to this conference. As you know, ACBF exists for the past 30 years in promoting human capacity building in Africa for the development of our continent. We African people, because no one else will come to develop our continent for us. And this is why, after observing that tobacco use is affecting the most active part of the population, ACBF has committed itself since 2014 with the support of the Bill and Melinda Gates Foundation in order to fight against tobacco use. The first phase of our commitment started from 2014 and 2018 by setting anti-tobacco use policies through the taxation of tobacco, banning tobacco advertising, and the use of graphic tickets and the promotion of smokeless environment. And the second part of our intervention started in 2019, and it will last up to 2022. In this phase, we have to provide increased support to our partners in order to overcome the institutional and human capacities and try to achieve or strengthen the good results that we have obtained during the first phase. There are many challenges in the tobacco control process. I'd like to quote a few of them. One, inadequate human and financial capacity of organizations to fight against the tobacco use. Second, there are problems related to the sustainability of tobacco control. And three, scarcity of local policies for the promotion of anti-tobacco use. And three, the interference of tobacco industry. Five, coordination problems between the tobacco control stakeholders. And finally, the inadequacy of policy, political commitment from the regional organization. And hopefully, after this meeting, we wish that the last challenge will be overcome. It is true that the urbanization of policies is a major issue for West African communities. ACBS in the second phase has decided to support CRES for the implementation of this objective through efforts made for taxation of tobacco. And we have decided to contribute in CRES project in order to build the capacity of ECOWAS member states for the development of taxation on tobacco. In addition to economic aspects, the enforcement of these new directives and policies on taxation will make it possible to improve the population, West African population's health and well-being. In ECOWAS, over the 6 past years, the emphasis was laid on the adoption of strong national laws on tobacco control and on the reform of taxation or the law on tobacco taxation. And these attempts have been successful because in 6 West African countries, more stringent laws have been adopted. And at the regional level, a directive on tobacco taxation have been adopted by ECOWAS member states and another by YMO member states. So emphasis is laid on the implementation of these regional directives. This is why this conference is organized for effective implementation of the ECOWAS directive on the taxation of tobacco products. I'm convinced that this conference will be an excellent learning platform because there are many professors who are attending, and we hope that the sharing of experience will be reflected in the field. I would like to wish you a productive conference. Thank you for your kind attention.